randomized into the Healthy Families group. The home visitor goes for one visit and explains the program in more detail, and the parent says, you know, it isn't really what I expected, so I think I'm not really interested in participating anymore. Now, we have to follow that person like she got the treatment group. She has to be in the treatment group, and we have to use her data as part of the treatment group when we try to compare that with the control group. So you can see that limits the significance of the study quite significantly that way.
Can you explain why that's important to researchers now?
Yeah.
It seems contrary to what anyone would think would be.
I'll try.
Sense.
Darlene will help me out if
I was going to say, I knew I'd get that question back.
I think it really has a lot to do with like how you try to generalize your results. And you really want to be able to say that this treatment group, I mean, when you get involved in a treatment, that this treatment leads to this outcome. And the fact that people dropped out of the treatment just means that you're not doing a very good job with the treatment. That's kind of the way I think it would be looked at, rather than, well, the treatment does work for this group of people, and the people that dropped out early it doesn't work with. So it's complicated, and I think it's made it harder for us to show human service outcomes. And I especially think it's maybe a little harder in prevention, and people don't get this, because in prevention, think about it, you're not electing to be involved in treatment. In fact, we're going out of our way to recruit people, beg them to be involved. This could really help you, knowing that you would expect a higher level of dropout. Whereas if we were doing an intervention study and we were looking at people that were seeking treatment for depression, they would be coming to you, I'm really depressed, can you help me? They'd be more motivated, more engaged in the process. They're not going to drop out as prematurely. So now we even have a harder standard that we have to adhere to. But I felt like it was important to do these top things. People still might criticize us for doing, but I felt like we really needed this intent to treat analysis in order for people to really say, okay, this is a good study. It's passing some conservative tests, and the results will stand.
And just to follow up on that, the intent to treat analysis piece is really critical for evidence-based programs. That's actually part of the government guidelines. For any program to be considered evidence-based, the research needs to be that intent to treat. It's actually brought over from medical research when if I give you drug A and I give you drug B, but you start having bad side effects, you drop out, you still have to stay in the drug A category while she stays in the drug B for the final analyses. There's just sort of been that decision that anything that's done within the social behavioral realm, and especially anything with prevention, it does, as he says, make it very hard, but it's really taking that intent to treat piece all the way over to that social behavioral arena as well to meet these government guidelines.
Okay, thank you.
But I think that's important for us to just be able to look at this, and so now you can see we have a lot of challenges in trying to really produce the kind of evidence that people want, which is all the more reason that we got to work together. We have to get the numbers. We have to just do everything that we can together to really put good experiments to the test, because otherwise we'll end up with a study like the ones that we talked about earlier, where maybe they don't have enough numbers, they're not well implemented, and they've done the analysis in a way that just doesn't show any impact. But in that design analysis book, one of the main points that this very famous researcher made is he basically said to everybody, look, almost all the experiments that you're doing in social sciences, they're underpowered, and you guys are all saying that they don't work. When instead, he was arguing that, well, you don't have your designs aren't sensitive enough. And you need to understand that that might be part of the reason that you're not finding what you expect to find. So we're, as evaluators, we're really sensitive to that. We're really trying to help address that. So this was just for the randomization. You always have to do a comparison between the treatment and the control group. So they were all the same. You can see they're all non-significant, which just means that the randomization worked, that everybody in the treatment group looked the same as the control group. So just for example, like a key one, involvement with CPS, 12.3% in the Healthy Families group, 14% in the control group, basically the same percent, so they're similar. And you can see by looking at this that we've known this. We get the right people involved in the treatment. There's a number of risk factors, and it's a high risk, if you will, a high risk population, or at least a population that could use some additional support and services. Ready for the results? Shall we unveil the curtain? Okay, so we got some really good findings. So I think this is very exciting. You know, it's really nerve-wracking to be a researcher and have worked in a program like Healthy Families and then have to do this kind of research, you know. So
It's very nerve-wracking being a program person.
Yes,
and
it
doing
is.
it. And I wanted to give a shout out to Southwest Human Development too for their participation.
Yes, absolutely.
And for you guys.
So we were happy to find some of these parenting results. We found in this study that regular routines showed better results in the treatment group than the control group. We found that in the Healthy Families group there was a reduced chaotic household. We found that reading to the baby was higher in the treatment group than in the control group. We found that parenting competence was better in the treatment group than the control group. Parent-child behavior in home environment, interesting, the home environment, which might be expected, had the biggest effect size, you can see 0.47, so a really big impact there on the home environment. And I'm going to break these down a little bit more, but go ahead, Paul.
What are the asterisks for?
Oh, just for significance.
So is that suggesting that the one without an asterisk wasn't as
Parent-child
significant?
behavior. Yeah, it
That was
didn't
the
meet
one
that
didn't
point,
meet the
that didn't
threshold?
meet that 0.1 threshold.
That's
It's
what I
close,
thought it did, but I
but
just
Yeah.
wanted to make sure.
But still,
Good effect size.
but what I would still say is that it's meaningful to be considered significant because the effect size is 0.24. So it was still showing a good effect. So what we didn't find an effect on was parenting efficacy. Again, kind of close. We used a subscale called corporal punishment. And so that was a little surprising. We did not find a difference between the treatment and the control group in terms of how they endorsed corporal punishment. It was about the same. Maybe because these babies are still young, it's not as relevant as a measure at this point. I know in the Oregon study, they also used this exact same subscale. They didn't find a difference between their treatment or their control group either. So interesting. Obviously, these studies raise as many questions as they answer, so we're still curious to know about that. Father involvement, I know that Healthy Families works on father involvement. It's hard to measure, so you know, again, I'm not sure whether we capture that as effectively as we would like, but we didn't see a difference. And then the one measure, role satisfaction, we found in the opposite direction. So sometimes you find that, but in a way, this is a good validity test. That almost all of our results were in the predicted direction. This one was not. In this one, the families in the control group reported higher role satisfaction than the families in the healthy parenting group. So that might be something for you guys to ponder about, because perhaps there's something about being involved in a program, thinking about trying to be a better parent that leads to a little bit less satisfaction, perhaps.
Thinking about it too much.
And in terms of safety practices, we used the safety scale. We found a big effect there, and you can see if you break down the individual items, electrical outlets, locked poisons, car seat use, and poison control, you can see that there are differences between the treatment and the control group. So the treatment group is producing a safer home environment. And then I was really excited about this. When we looked at health, we found that there was a significant effect for breastfeeding. So I didn't expect to find this. We hadn't always seen a lot of increase in breastfeeding, and I know there's some emphasis in the program on that, but it's not, well, I don't know, you guys can correct me if I'm wrong. It didn't seem like it was a huge part of something that Healthy Families was necessarily really working hard at, but obviously enough that it showed an effect. And I think it's important because maybe there's some long-term benefits. So think about the health benefits of breastfeeding over time. This could be quite significant. We did not find any difference in immunization, so that's interesting. There's been historically a big emphasis on Healthy Families, like we do immunizations, but our control group was getting immunized just as equally as the Healthy Families group. This is still early at 6 months, so it'll be interesting to see if at 1 year there's maybe a difference. I don't know. And in well baby visits at 6 months, no difference between the two groups. In terms of mental health, we found, we used a measure of goal setting and future orientation. We found some significance there, and then we found difference on the mental health index, kind of a general measure of mental health. So we found that the Healthy Families mothers showed a pretty big effect size of better change in mental health than the control moms. We did not show a difference on depression, social support, personal care, or emotional loneliness.
I'm surprised about social support.
Well, that's actually an interesting point,
Yeah.
Pauline, because we have always had a hard time finding a social support impact. And I don't know why, I'm not really sure why, because you would kind of think that, well, just having a home visitor at your side would naturally lead to you feeling more social support. But maybe the moms don't quite see the home visitor exactly that way, and they still feel kind of isolated and a little bit, from their new parenting experience. And it's hard, it's hard to connect those moms to additional support services. So
And that's one of the things that we see pretty much every year for the Healthy Families program as a whole, that at 6 months, there's occasionally sometimes a change where they're feeling more social support, but by the time we hit 12 months, any gains that they had in social support are completely gone. Sometimes they're even lower than they were at baseline. So, and we really don't have a good answer for that one right now.
Well, it could be we're asking the wrong questions too.
Yeah.
We could be asking the wrong questions.
yeah, it's kind of hard to know what are we really tapping into when we're looking at social support. But I think it's a really important point, Pauline, because many programs evaluate social support, and I'm telling you, I've looked across a number of studies, and they frequently don't show an effect. So, and again, choosing the right measure is important. So maybe we need to try to think about a better way of trying to capture that. That's why this measurement stuff, it really matters in terms of what we get out of the evaluation and the research. In terms of maternal outcomes, we found a small effect for using contraception, 10% greater use. That's important from a health point of view, because if we can enhance birth spacing, we know that we can get better health outcomes. So we got a little bit there. Subsequent pregnancies, there was not enough, 1 in Healthy Families, 3 in the control group. And in job training and employment, we didn't see any difference there. That was a little bit surprising too. But.
Do you think it's the duration of the study though, or at least these findings? Because 6 months, to see a difference there may not be enough. But
Yes.
at a year and a half might be different.
It might be
That's what
different.
I would think.
Yeah, I think that's true. I think that's true for a number of the findings. And then use of resources, we found a difference in their ability to use resource and their ability to mobilize resources. I think this is important because if we can help these families know how to use resources when they need them, then I think maybe we're making a big impact. And when we did, many years ago, when we did a qualitative study, one of the things that we found is the families said to us when we interviewed them, I was really surprised that they were able to help me and that they were open to helping me. Because a lot of these families, honestly, frankly, they had negative experiences with social services. And now all of a sudden, they had somebody that really seemed to be reaching out and really wanting to help them. And they were surprised by it. They were like, wow, I can't believe somebody really wants to help me that much. And I think that could have a big impact. But see, this is a kind of effect where you think about this, we'll probably never be able to measure this. But what if when this mom's kid turns 14 and she needs help for the 14-year-old, and she's had a positive experience with being able to utilize social services, she gets the help she needs for her 14-year-old. I mean, how cool would that be? But you can see we're never going to be able to go out 14 years and discover whether or not that's really true. And then, then this is a summary. So this is for you, Suzanne. When we looked at the Healthy Families Parenting Inventory, we found pretty good results for many of the subscales: problem solving, mobilizing resources, parent-child behavior, home environment, almost parenting efficacy. And so what we were able to document is that the inventory is able to show change. Now, I don't have the slide in here. I don't think, let me see, no. But we had used subscales from the Adolescent Adult Parenting Inventory, which is a very widely used instrument for measuring outcomes. none of those results showed any difference between the two groups. And the reliability was terrible when we looked at it. And I think that measure